Welcome everyone to the Emedica Foundation SJT Essentials for Foundation Program Entry 2023. For those that haven't met me before, my name is Mahibur Rahman. I'm a portfolio GP based here in Birmingham and Solihull and a consultant in medical education. I'm one of the authors for the Prescribing Safety Assessment, and I'm an examiner for the OSCEs for Liverpool Medical School, and I'm a former examiner for the General Medical Council for the PLAB Part 2, which is an OSCE-based assessment for international medical graduates to work in the UK. And I also was an invigilator for that exam. Our team have got a lot of expertise in situational judgment tests, and I was the author of the first article on SJTs in medical recruitment back in 2007, and also the first article on the use of the Foundation SJT. I've been teaching about SJTs for GP training and lots of other specialties that use an exam called the MSRA, the Multi-Specialty Recruitment Assessment. 10 different specialties use that as part of entry to ST1 or CT1 specialty training. So half of it's clinical, half of it's SJT. I've been teaching around that exam since 2007, and I've been teaching for the Foundation SJT since it started back in 2012. And our team at Emedica have now trained over 61,500 delegates. So, we're fortunate to have a really experienced team. Joining me today in the faculties, you'll see them helping to answer questions, are members of the core Emedica team. We've got Masuda Rahman, Anna Greathead, Tuba Jamil, Laura Smith. Okay, so you'll see them answering questions. So some of you might not have heard what a portfolio GP is before. It means I'm a GP with multiple roles. So I'm a partner in my own practice. I'm one of the senior GPs at a secure unit for women with significant mental health. This is me there. I was in clinic there this morning, but this was back in the pandemic. But it means that I also hold other roles. So my other roles are mainly in medical education. So as well as teaching for Emedica, as I mentioned, I'm an examiner. I also run courses in conjunction with Health Education East of England, KSS. We've run courses for membership for them. We've done joint courses with the Royal College of General Practice. I'm going to start with an overview of the SJT for 2023 entry, including some of the key changes. What's the format? What are the big things you need to be aware of? Then the main teaching is going to be about tips and techniques for the SJT, but we'll do some sample questions for each of the sections and look at some of the key things that you need to watch out for. I'll touch on what is the core knowledge you need to gain, because the SJT is mostly technique, but there are some questions where some knowledge will help. What is that? We don't have time to cover the actual knowledge, but I'll tell you what you need to cover and how you can cover it efficiently. Then we've got time for questions and answers. The last session is important. We'll talk about useful resources and some final tips. Great, so let's make a start with the essentials of the SJT. So let me just launch the first poll so we can see how that works, okay? So you'll see actually it's got 5 options, but just pick from A, B, C, okay? So what do you think is the true weighting of the SJT compared to the EPM in your FPAS rank for 2023 entry? So A, if you think it's 50-50, B, if you think the EPM has actually got more weight than the SJT for some, and C, if you think the SJT has got more weight than the EPM for some. Okay, so 86% of you picked A, 50-50, and then about 13% picked C, that the SJT's got slightly more weight, which is actually the correct answer. The SJT actually has more weight than the EPM. Actually, I'd say for some, it's for most people. I'll explain why, because you might have read in the official Foundation Program website that they tell you there's 50 points for the EPM, 50 points for the SJT. So it seems like they're equal, right? But it's not. Okay, we'll come on to why in a minute. Let's do another one. Just select again what you think is the answer for how many different subtypes of questions are there in the SJT for 2023. So do you think there's 2, 3, 4, 6, or 9 different subtypes of SJT? So most people picked 3, okay? The correct answer is actually 9. There are 9 subtypes. There's 3 different parts to the SJT, 3 different types of broad questions, but each type has 3 subtypes. And the question was about subtypes. There's actually 9 subtypes. Some you might never have seen before, okay? Because they're fairly new. And then last question, and then we're going to get into it. Roughly, what proportion of the marks do you think are from section 3? So section 3 is the last part of the exam, is the ranking questions, where you rank things from best to worst from 1 to 5. There we are, polls open. So what proportion of the marks do you think comes from the last part of the exam? So the most popular answer was C, about 40%, followed by D, 50%, which is the right answer. Actually, slightly more than 50% of the marks are actually in the last part of the paper in section 3, the ranking question. So we'll look at all of that in a second. So let's make a start. So your exam will have 75 SJT scenarios in total. But usually there's about 10 or slightly more pilot questions. These won't be marked in any way. They won't look any different, but they're questions that carry 0 marks. They're there for research purposes to develop new questions and validate questions for future exams. So you've got to take all 75 seriously. You don't know which ones are going to be marked, which ones are not going to be marked. And you can sit it in December or January. Some of you, it would be that your medical school, everyone there does it in December. December's the bigger cohort. Some of you might have a choice, okay? Now, there are multiple equated test forms. So what that means is, like the December exam and the January exam, they've got completely different questions. And then there's a reserve exam for the end of January for those that were due to sit January and are sick or can't make it, because someone that was due to sit December and is sick or can't make it, they'll be shifted to the January exam. But there's actually a third smaller exam. They all have different questions, but they're equated, i.e. they will have the same number of questions in each section. They will have the same proportion of easy, medium, and hard questions. So we can compare someone that sat it in December to someone that sat it in January to someone that sat the reserve. And most of you will sit it at a Pearson VUE test center. There's Pearson VUE test centers, 150 of them in the UK, but they're available all over the world. And some of you might opt to sit it online proctoring from home. So for standard timing, it lasts 2 hours and 20 minutes. For those that get extended time, for example, someone with dyslexia or other forms of neurodiversity that has already had an assessment and gets extra time in the exams at university, and you provide the evidence by the right time, you get extended time. You get 2 hours and 55 minutes. And what some of you might not be aware of is that the points are allocated via a competitive ranking algorithm. So you're going to get a score for your SJT from 0 to 50 points, allotted to 3 decimal places. Anyone in the bottom 0.5% of all scores, they consider this an exceptionally low score. They'll have to basically have an interview. And if they don't get through that interview, they would be withdrawn from Foundation program. All right. You see, overall this year, one of the big changes is that the additional points for additional degrees, for publications, papers, all of that's been dropped this year. So your entire EPM is just based on your decile ranking. And so everyone will get their EPM score will be somewhere between 41 and 50. No one can get less than 41. No one can get more than 50, right? Whereas previously, the lowest was 34 for EPM, and then you could get additional points from papers, publications, having done additional achievements, national prizes, those kinds of things, okay? And then for the SJT, whoever gets the highest score in the country will get 50. Whoever gets the lowest score will get 0 points from the SJT. It's a competitive ranking algorithm. It's not about your proportion of the marks. Like the person who got 0 marks last year from the SJT, it's not that they didn't get any questions right. It's just that they had a lower score than anyone else. So they get allocated 0. So do you see, your total score for the foundation program will be somewhere between 41 and 100. Now, do you see, the variance from the EPM is only from 41 to 50. The variance for the SJT is the rest of it. So really, no one's going to score less than 41. No one can score 40, all right? So what you're looking at is really it's between 41 and 100, and only 10 of those marks are from the EPM. The rest of it is from the SJT. Do you see why the SJT is actually more important? Okay. Here's another one. Just type this into the chat. If you got about 80% of the available marks in the actual exam, roughly what would you get out of 50.00 SJT points? Roughly. You see, a lot of people would think that they'd get, if they got 80%, 80% of 50 is 40, right? But that's not how it works. Based on the latest set of data we haven't published the data from last year's exam yet. But from the data from the year before's exam, 2021 entry, candidates that got 80% of the marks available only got 35 SJT points. And that's because it's not about how you score as an absolute, it's about how you score compared to others. Lots of people scored more than that. So because this was significantly below the mean, they got a lower score. You see, 80% was much lower than the mean score. So you get less than the mean SJT, okay? Again, this is the score distribution from 2021. They haven't published the 2022 data yet, okay? I know that a Freedom of Information Act request has been put in to try and get the scores, because normally they publish a report. When they don't publish a report, usually a couple of doctors put in for a Freedom of Information request to get this data. But this is from the last available published data, okay? So The mean in that year, 2021, was just over 40. The mean last year we do have, it was 41.087. The person that scored the highest got 50. The person that scored the lowest got 0.00. Okay. But if you look at the breakdown, less than 10% get more than 44 points in the SJT. Most people, so look, if you add these together, you've got nearly 65%, nearly 2/3 get somewhere between 38 and 44. All right. Then you've got a smaller cohort that are going to get 36 to 38, and about 11% or so less than 34. And then there's a little bit below this, the ones that get between 25 and 0, very, very few people. Okay. But you see, like this year, one of the things is from the EPM, the lowest will be 41, but the SJT will still be from 0 to 50. So let me show you how that might impact this year's students. I've got 5 fictional students here. Mary, first decile at UCL, intercalated, got a first in a bachelor's, managed to get 2 publications with her supervisor from her dissertation project for her BSc that she intercalated in. Okay, phenomenal. Because she's first decile, gets 50 points in the EPM because this year is from 41 to 50. All right. But let's say she had an awful day on the day of the SJT and only got 30.215 SJT points. So she was significantly below the mean. So her total will be 80 point change, 80 and a bit. Okay. Ravi, 5th decile at Manchester, also intercalated, got a 2-1. Again, good solid performance. Gets 46 for the 5th decile, gets nothing for this. Okay. Scores just below average in the SJT, scores 38 and change. Okay. Average most years has been between 39 and 41. All right. As I mentioned, last year it was just over 41. So it's just below average. His total's 84. You see, significantly higher than Mary. Lynn, 6th decile at Cardiff, didn't do anything else. Good for you, Lynn. Enjoy medical school. Once you finish, you've got to apply for specialty training. You've got your whole rest of your life to work hard. This is the time to enjoy it. It's still got a solid performance. She's 6th decile. She's going to comfortably pass. Okay, get 45 for that. But scores better than these 2 in the SJT. 40.4, again, around the mean. All right. But that total puts her above the others. All the way down to Sarah, 10th decile at Sheffield, nothing extra, the lowest possible EPM, but gets a top 10% SJT. Remember, usually about 10%, just under, score 44 or more. So she's like well in the top 10%, 46.878. Total 87.878. Now, do you see the fact that it's just 3 decimal places? Look at this one. Peter, 8th decile at Nottingham, 43 for being 8th decile, 44.616. He's less than half of a point lower. Now, if all of these wanted the same place as their first choice, Sarah's going to be at the top of the pile. She's going to have the highest ranking of all 5 of these. Do you see? So now this is important for every single one of you. Why? If you've worked really hard and you've done really well and you're going to be in the first decile, congratulations, that's fantastic. All of that hard work is going to be worthwhile when you finish and you're applying for other things and for your work and so on. But it's important that you do well in the SJT, because it'd be a real shame to end up somewhere you don't want to be because you didn't take the SJT seriously. And a few questions can make a big difference. But equally, let's say for whatever reason you didn't do as well as you wanted in medical school. Some medical schools, for example, if someone repeats final year, no matter how well they do in final year, they automatically get ranked 10th decile. They have weird rules in some medical schools, okay? For whatever reason, if you didn't do as well as you want, if you do well in the SJT, you can make it up and still get your first choice foundation school. If we look at last year, you might have read about the fact that last year, a lot of students ended up on the reserve list compared to previous years. It was about nearly 800. Right. So to be number 1 at the top of the reserve list, you needed a total of 73.422 last year. Now this year, this is based on the lowest score in the EPM was 34. This year, the lowest score in the EPM is 41. So I suspect the lowest score that will make you into getting an offer in the first wave, i.e. not in the reserve list, will be higher than this year. That's my prediction. Okay. So to summarize, look, the SJT is actually, in terms of where you end up for the next 2 years, more important than the EPM, because of the fact that the scores go all the way from 0 to 50. All right. It's based on a national competitive ranking algorithm. You're ranked with everyone else that sits there. Say national, it's actually international, because anyone that hasn't already got full registration that meets the requirements can apply. The level of competition has increased significantly the last few years. Okay, if we look at the data from the last 3 years particularly, then last year and the year before, big increase, and actually this year is going to be even more competitive. And the way that the algorithm works, a small difference in your scores can make a big impact. If we go back to these candidates, you can see the difference between this score and this score, or the 40.402 and someone that gets, say, 40.602, might be one part of one question, not even one whole question. One part of one question could make a difference. So a whole question could be several hundred places in the national ranking. It could be the difference between getting your first choice and your second or third choice, okay, or getting your 8th choice and one of your low ones, or getting your last choice and being in the reserve list. So how well you do in your rank, really, it's about where you get placed. So if we can help you get a good SJT score, then hopefully you can get your first choice deanery. That's what ultimately we want. One thing that is important to understand, though, is as long as you're not in that exceptionally low scoring category, those that have to have that interview, everyone that is ranked, as long as you also pass your finals, you will eventually be given a job, because those on the reserve list, all of them were allocated a job later on in the process. Okay, so it's not about will I get a job. As long as you're not in that cohort that essentially are considered to have failed the SJT, and then as long as you pass finals, because some of you have still got that, some of you I know you've already done your finals because you do it early on in the year, okay, then everybody that meets the requirements will eventually get a job, right? It's just that the better you do, the greater your chance you get your first choice job. And that's what we're here to help you with. So let's make a start then on tips and techniques for the SJT, okay? Someone's asked a good question. How should we interpret previous year's average accepted FPAS scores for deaneries, because the calculations change now? The thing is that you guys essentially are the first cohort with this new system. So it's going to be difficult to say, because it's not as simple as saying that, look, 34 was the minimum last year, 41 is the minimum this year, so just add 7 to every score. It's not as simple as that. Why? Because some people that had 34 for their decile score might have had lots of points from papers, publications, and other things. Do you see what I mean? And so the actual EPM score total might have been really quite high. So it's going to be difficult, but certainly it's going to be higher. For every single foundation program, it's going to be a bit higher than in previous years, because the absolute minimum now is 41 from the EPM. Whereas if you look at previous years, lots of people had 37, 38, 39 in the EPM. No one will have less than 41. And it's exactly 10% in each medical school will have 41, 10% will have 42. You see, because the decile scores are a tenth, a tenth, a tenth. Whereas previously, there could be lots of people that had the same decile score, but one had a lot more additional achievements than the other, and so could catch it up, if you like. That's not going to be the case this year. All right. Good. So let's move on now to tips and techniques for the SJT. So now, what does the SJT test? Something really important is that this is not a test of clinical knowledge. You're already going to be tested on your clinical knowledge. That's why you'll have medical finals. That's why you'll have your written finals. Okay. What it tests is judgment and decision making. But within that context, some questions do test knowledge of key guidance, mostly GMC guidance and ethical guidance. Ultimately, what it's assessing is your suitability for working as an F1. And the way it's devised is they looked at what are the core competencies that an F1 needs to do well, based on following them around and seeing what's in their job, talking to other juniors, what do you value in your colleagues, talking to seniors, what do you value in the junior doctors in your team, and then what the GMC feels are key skills and attributes of a good doctor, and what they feel are important professional attributes. Okay, and so what will happen is they'll give you a scenario. It could be based in within any kind of ward, any kind of setting that you might be actually in an F1, because you'll have different rotations in F1. Okay, and within that, every question will be mapped to at least one primary domain, and often a couple of secondary domains. So they're going to see, do you show more positives or negatives for these core domains? Commitment to professionalism, coping with pressure, effective communication, patient focus, and working effectively as part of a team. Now, within these, a lot of questions, they're not testing any knowledge. They're just testing attributes and judgment. But some of these, within these domains, to do well, having a good working knowledge of GMC guidance will make it easier for you. Okay. So let's look at the actual format of the exam. So there's actually 2 separated sections with 3 parts. Each part has a different type of question, and there are different approaches, and how they're marked, how you need to think about it is different. So section 1 of the exam, the first half of the exam, if you like, has got 2 parts. Part 1 are ratings questions, okay, where you will rate things appropriate, somewhat appropriate, inappropriate, very inappropriate. Okay, this is worth about 450 marks. So there's 18 top level scenarios, but each scenario will have somewhere between 4 and 8 subparts, stems. So in total, there'll be about 114 stems, each worth 4 marks, so about 450 marks. I've put this approximate because it's slightly different each time. Part 2 are multiple choice, where you'll have a scenario, there's 8 options, you pick 3 from those 8 that taken together address the situation. Okay, these are worth 12 marks each, so there's 228 marks for this section. Historically, there used to be 20 questions for this part. Last year, they changed it to 19, so it's going to be 19 this year. So you've got 70 minutes for this part. Then there's an optional break for 10 minutes. If you want to stretch your legs, use the bathroom, you can. If you choose not to, and you start the next section of the exam, section 2 is the next 70 minutes, you won't get 10 minutes extra. It will still be 70 minutes. Something really important. These 2 are completely, just imagine they're 2 different exams. You're doing them back to back. So once you're like between part 1 and part 2, you can still go back. But once you start the second section, which is part 3, the ranking questions, which is most of the marks, you cannot go back and check or change any of these answers. They're locked. That's really, really important. They introduced it for the first time last year, and they didn't really make that very clear. A lot of doctors had no clue about it, okay, until they turned up to the exam and suddenly they were faced with this. So I don't want that situation to happen to you, all right? Because some people, what they did is they allocated their time thinking, I'm going to spend this much on this much on this, and then this much on this. But when they then ran out of time for here, they couldn't carry any time across. You know, someone rushed through this thinking, I'm going to need more time for this. You can't. You've got 70 minutes for this. You've got 70 minutes for both of these together. They're separated in time. Okay. So part 3 is ranking. This is where the bulk of the marks are, 760 marks. 38 scenarios. Used to be 37. It's going to be 38 scenarios. And you rank 5 options from best to worst. Okay. So let's make a start and look at each of these questions. So part 1 are the ratings questions. These are the newest format in the SJT. They've only been around for a couple of years. So you'll have a core scenario, and there's multiple stems, at least 4, maximum 8. Each stem is marked separately. And in each stem, you'll be asked to rate. There's 4 possible ratings. The most common type looks like this. So have a look at this question. Okay, I'll give you a bit of time, and then I'll launch a poll. Okay, I'm going to give you a few more seconds to just select that answer. Now, something really important. You see this bit here? This will stay exactly the same for all of the stems for a given ratings question. So what you want to do is you want to read it carefully the first time, spend maybe 45, 50 seconds, including answering this first one. But then each of the other stems, you've only got about 15 seconds for each one. Otherwise, you're not going to get through 114 of these in time to also have time to do part 2 before your 70 minutes is up for the first half. And then remember, it's 70 minutes for the second half. Okay. So that's enough. I'll close the poll there. So about 2/3 of you picked A, very appropriate, about 30% somewhat appropriate, and then very few people picked the others. Okay, so let's just read back. And when you read this, try to picture the scenario. So it will always place you as a junior doctor, as an F1. Okay, but as I said, it could be in different rotations, in different settings. So in this case, you're F1 working in the surgical ward, and it's a night shift. You're tired, and while you're cannulating a patient, you're asked to do another job by a nurse. It's a really common scenario. You know, almost every SJT is based on something that really happened. And while you're trying to cap the cannula, bright red blood spurts out, and you realize that you've accidentally cannulated an artery and caused a patient significant pain. This happened to me once in real life. Okay, it's pulsing and spurting really far. If you put it in the vein, it won't do that. And you know, the patient screams. The thing is, it's difficult because some patients, they start screaming before you've even put the needle near their skin. So then if you've got a screamer, then it's difficult when you then put it in the wrong place to know, are they screaming more because you've made a mistake? Mistakes can happen, or because they're just a screamer. Okay. And then the most common type of subtype of ratings question will ask you to rate the appropriateness of actions. But this one is one of the subtypes, which is rate the appropriateness of the following responses to say. Again, this is a new subtype asking about, and you have to assume that whatever is said in a polite way, and then it's in speech marks, word for word, this is what's been said. So I'm so sorry I've hurt you. Okay, so this is A, very appropriate. So well done. You know, 2/3 of you have got that right. Okay, why is this very appropriate? Because you've acknowledged responsibility. I've hurt you. You've apologized for it. You've taken ownership for it. So this shows empathy and sensitivity. You're communicating, you're taking ownership. And you see, it's got all positives. There's nothing negative about this statement. That's why it's very appropriate. Okay, let's look at the next one. Just 15 seconds. Okay, poll is launched. Please select your answer. So you see, all of this has stayed the same. It's just what's actually been said now. So now, rate the appropriateness of this response to say, it's because the nurse distracted me. Right, great. So again, much bigger proportion of you picked one answer here. Nearly all of you picked D. This is inappropriate. Now, I want you to imagine, when you say inappropriate, imagine the word very, because inappropriate means very inappropriate. Okay. It also gives you a nice symmetry. You know, very appropriate, somewhat inappropriate. Inappropriate, it means very inappropriate. Do you see, this is entirely, there's nothing good about this. You've not said sorry, you've not taken ownership for it, and you're blaming a colleague, you're throwing your colleague under the bus. All right, it's because the nurse distracted me. Do you see, absolutely inappropriate thing to say. Okay, right, good. Let's do the next one. Right, okay, so now again, about 2/3, 1/3. So about 2/3 of you picked inappropriate. Remember, that means very inappropriate. And then most others picked somewhat inappropriate. I think that's right. Yeah, 2/3, 1/3. Okay. Now, the correct answer here is D. This is, again, very inappropriate. And this is what I call the rating strap. Be honest, let me know in the chat, how many of you looked at this and said, this is a really awful thing to say? Like, you've made a mistake. Not only are you not saying sorry, not only are you not taking ownership, you're actually now blaming the patient who's already in pain and upset. It shows a lack of empathy and sensitivity. So it's only a negative for one of the core domains. Doesn't show taking responsibility. It's very unprofessional to say you have very awkward veins. So you're blaming the patient. It's absolutely inappropriate thing to say, right? So how many of you, that's what you actually thought and were drawn to, but thought, I've just put inappropriate for the last one. They wouldn't put two in a row. And so you changed it from D to C, or you actually thought, I have to pick different options for each of the different ratings. You thought you couldn't use the same option more than once. You thought that that's how it worked. Be honest. Let me know in the chat how many of that, you know, because 1/3 of you is a big number to not get that right? Okay, let me know in the chat if there was anyone that actually your natural instinct was it is D. This is awful. This is very inappropriate. But you picked C not because you thought it's the right answer, but because you either thought they wouldn't put 2 in a row, or you thought you couldn't use the same option multiple times. Yeah, so a few people are sharing that. You see, first of all, you might use the same, like if every single one in one particular scenario, if every stem is very appropriate, select very appropriate for every single one. They could all be the same option. Some of them you might not use at all. Some of them you might use multiple times. Don't think, oh, because I've used that one twice, there can't be a third one. That's actually a really common mistake that leads candidates to lose marks. This is what I call the rating trap. Okay. Okay. Now let's have a look at this one. So this time it's, I'm sorry, this occasionally happens with some patients. This is probably the hardest one in, I started off with a few straightforward ones to get you going, but this is probably the hardest one in this set. Okay, so I'll close the poll there, and I can see that about 60% thought it was somewhat appropriate, about a fifth thought it was somewhat inappropriate, and then a split then between very appropriate was the rest, about 15%. Hardly anyone picked inappropriate. Okay, that's really interesting. This is the hardest one in this. The correct answer here is somewhat inappropriate. Now, why is it somewhat inappropriate? Right, so here's a good framework for thinking about ratings. Very appropriate means that it only has positives. There's nothing negative about it at all. Okay. Somewhat appropriate means it's heavily positive, but there may be some negatives in it. Okay. Somewhat inappropriate means there's on balance more negative than positive, but there will be some positives. Inappropriate, remember that means very inappropriate, only negatives. There's nothing positive about it at all. Okay. So the reason this is somewhat inappropriate, there's something good about this, and that is that at least there is I am sorry. Okay. And that's why there's a positive there. But the reason that it's not somewhat appropriate would be more positive than negative. It's got both positives and negatives, but more positive than negative. Somewhat inappropriate is it's got positives and negatives, but more negatives than positives. So look, I'm sorry, that's the only positive. The rest of it is negative. Look at and you see, when these responses to say, it's in speech marks, it means that every word you have to take exactly as that's what's been said. Okay. So this occasionally happens with some patients, not, I'm sorry, I've made a mistake. I'm sorry, I hurt you because I lost focus. Taking ownership. It's almost like you've said I'm sorry, but then after that, there's no ownership of what actually happened. This occasionally happens, very passive, as if it's just happened. It's not I've made a mistake. It just happens with some patients. Again, suggesting there might be patient factors. It might be something to do with them, rather than I'm sorry, I'm really tired and I made a mistake. I lost focus. It's my fault. Okay. It sometimes happens as if it happens. It's not that you've done anything wrong. It just happens sometimes with some patients. Again, suggesting that it's to do with patient factors rather than the doctor factor. So it's actually not taking ownership for it, not owning up to that it's to do with you. It's almost putting it on some patients. So like some patients like you, it's not as bad as this one. We're actually saying you have awkward veins, but you see how it's alluding that it's to do with the patient rather than to do with you. Okay, and that it's just happened rather than you've made a mistake. All right. So the reason it's not inappropriate is that there is at least I'm sorry. All right. But it's just that after that, this is like what I call an apology, where you like a fake apology. You've said that, but afterwards you're not actually taking any ownership of it. All right. And so there's one positive and two negatives. That's why it's slightly more negative than positive. So it's somewhat inappropriate. Now, those of you that put somewhat appropriate, the good thing is the way these are marked, if you're only one away, you still get the bulk of the marks, okay, because of the way they're marked, okay? So this is somewhat inappropriate because there's more negative than positive, okay? So just to recap, part one, there's going to be about 114 stems, i.e. each bit of this is one stem, okay? In total, there'll be about 114 stems. The most common type of question will actually ask you to rate the appropriateness of different actions. And the 4 ratings are very appropriate actions, somewhat appropriate, somewhat inappropriate, inappropriate. Read inappropriate as very inappropriate. Rate the importance of considerations. There will be certain statements or factors to think about. And so do you think that it's very important to consider this factor? Do you think it's important, of minor importance, or not at all important? That's the 4 ratings. And then the one we've just seen, rate the appropriateness of responses to say. Is it a very appropriate thing to say, somewhat appropriate, somewhat inappropriate, or is it inappropriate? Okay. If I just go back to the marking of these. So there's maximum 4 marks for each one. If you get it right, you get 4 marks. Let's say the answer was C. If you had either B or D, you're 1 away, you get 3 marks. If you put very appropriate, you're 2 away, so you'd get 2 marks. Okay. If, like in this one, the answer was D, okay, so you had D, you get 4 marks. You had C, you're 1 away, you'd get 3 marks. You had B, you're 2 away, you'd get 2 marks. You had A, you're 3 away, you'd get 1 mark. Okay, so that's how ratings are marked. There's 4 for each bit. Okay, right, so part 2 are the multiple choice, or sometimes known as selection questions. So you get a scenario just like part 1, but there's 8 options on the same screen to read from, and you need to select 3 that taken together make the most appropriate combined response. Okay, so you've got about a minute and a half for each of these if you want to finish on time. So let's have a look at the question. Here we go. Okay, time's up. Make your decision. I'll launch the poll now. So please select the 3 most appropriate actions to take in this situation. Okay. Now, by the way, this is a really, really hard question. But I've picked this because if I've got very limited time with you today, I'd really like to pick questions where I can really give you some key techniques that you can learn something from and apply to other challenging questions. The easy ones you'll be fine with anyway. Okay, so I'll close the poll there. So I can see that popular answers are A, B, and G are the 3 most popular answers. A, B, and G. Okay, so again, let's do a quick read through. Try and picture the scene. So you're working in general medicine. The son of a patient was recently discharged, so they're not on the ward anymore, asked to see you privately on the ward. He expresses his gratitude for the care given to his mother, and thank you for the way you looked after my mum. And he offers you an envelope with £30 cash in it. Okay, so that's the scenario. So the preferred response is A, C, and G. Okay, now lots of you had A, lots of you had G. Very few of you had C. A lot of you, like the one you had instead of C, was B. Tell him to keep his money. Now I'm going to show you something really, really important here. So remember I told you that for some questions, knowledge of GMC guidance can be useful. So I'll talk to you about the GMC guidance about gifts, because a lot of people, I don't know where they get this, but there's a lot of myths about it. Okay, but the other thing is much more important is that the technique for answering this. The key thing is that you've got to add it together. For selection ones, the key word in your mind should be and. If you're picking A, C, and G, you've got to add A, C, and G, not necessarily in alphabetical order, together with the word and in between, and together it's got to make sense. If it doesn't, okay, if it doesn't, maybe you've got something wrong and you want to change something, okay. And what you can do with this one, there'll be some options where you can think, you know what, this shows a negative or a potential negative for one of those 5 core domains that they're testing, okay. You probably don't want to pick those. And sometimes you might be able to eliminate out of the 8 options, there might be 2 or 3 that there's something bad or wrong with it. And then it makes your decision easier. You're picking 3 from 6 or 3 from 5 rather than 3 from 8. So let's do that. Let's get rid of ones where there's something wrong or potentially wrong with it. And then from what's left, you want to pick the best 3. Okay, so we'll start with B. What's potentially wrong with B? What could B show a negative for? And again, this is where picturing the scene can really help. Okay, you see how this is very different to the ratings. This, you're looking at all of these together, and all of these together is your whole response. Okay, whereas in the ratings, each bit, you're looking at that in isolation. You're not comparing it to another one, and it doesn't mean that's all you're going to do. There could be other things. Okay, so yeah, the main thing, a few people have said that he could be offended. Okay, and that the word tell him, it's a rude tone or like a command. Absolutely. Okay, just picture this. This is different to, you know, like if you happen to be on the ward the day their mum's being discharged and they've seen you around as the junior doctor, you're the one that will have done the discharge documents, you will have been the one come and explain the blood results, you know, they've come back, or taken the blood sometimes when the phlebotomists are busy or whatever. So, you know, they've seen you probably more than some of the other more senior members of the team. And if they happen to be there when they're being discharged, they must say, oh, doc, you've been really nice to my mum, you know, here's a gift card for Costa, go and get a coffee on us or something like that, right? But look, his mum's already been discharged, so he's come specifically to find you, asked to see you, said, I'm so happy, and he's gone envelope with £30 cash. People don't just carry an envelope. This is planned. He's gone to a lot of effort, okay? How might he feel if you then tell him to keep his money? Now, it's important that you look at these as it is and not make assumptions, okay? Because if some of you looked at B and thought, what I was thinking in my mind was, I'd explain to him that there's no need for money, for you seeing his mum get better, you know, was really rewarding, and you just were doing your job and being professional. That's wonderful, but that's not what it says. It says, tell him to keep his money. That's different to explain that there's no need for money because you were just doing your job and you were really happy to see his mother do well. You see, you can't add that. You've got to read what says. So it could leave a really bad taste in his mouth. He might be really upset by this. He's already gone to bring this, okay? Okay, and then if you look at option F, ask him not to tell anyone about this. Shh. You know, you're not doing anything wrong. Why would you ask him to cover it up? So F is another one you can get rid of, okay? Option H, what's potentially problematic about that? See, if they'd given a thank you card, it'd be absolutely fine to mention in your portfolio an entry that you got a thank you card, and then your supervisor would see it, and at ARCP, you know, that's a nice thing. We often do keep a record of, where people have given nice feedback and discuss it. But to ask someone specifically, they've already gone out of their way, to ask them now, look, as you're here, write something down so that I can put, that's inappropriate, you see, okay? So now you're left with D and E. There's nothing wrong with D, there's nothing wrong with E. Okay, out of D and E, if you had to pick one, which one's better out of D and E? If you had to pick one out of D and E, we're not going to pick either of them, but if you had to, which one's better? See, out of D and E, E is better, because look, he's already gone out of his way. Imagine now saying, look, I'm really glad about your mum, but look, we want chocolates. Could you go and buy chocolates now with that money, then come back and drop it off again? You're asking him to go out of his way more. Whereas if you took the money and bought chocolates for the staff, the net result is still chocolates, but you're not troubling him any further. You see, out of D and E, E is better, D is worse. So, but why wouldn't I pick either of these? Because A, C, and G make a better response together. And so here's the litmus test. Add your 3 together and ask yourself, does it together make sense? And then why is it that out of C, D, and E that I would pick C? Because the net result of C is that something that can benefit. Can see if they donate the money to the ward. Have you ever seen the relatives room, you know, or the waiting room when you go into a ward? You'll often see there'll be like a sofa there, or there'll be like an armchair there, and there might be a little plaque donated by the patient's fund, or donated by X in loving memory of his mother. Or sometimes you'll see on children's wards, there'll be like an incubator, and it'll have a little plaque donated by the patient fund, or donated by donations to the ward. Okay, that money that's given to the ward can be used to benefit other patients, staff, relatives, carers. It can help lots of people. The net result is often equipment or other things that will help. Whereas the net result of DNA is chocolates. All right. So C has got a better net result. Now let's do the litmus test. Does it make sense? And then we'll cover that bit of theory. So does this make sense? You're on the ward. He offers you £30. Thank him for his gesture, saying it's very kind. Thank you for offering me. That's really kind of you. But I'm not the only one that looked after your mum. Everyone looked after your mum. So look, if you really want to do something, why don't you donate that money to the ward? Then it can benefit everyone, including future patients. And because he's talked to you about this, when you see the ward staff next time, do you remember Mrs. Smith? Her son was here, and he was saying how happy he was with the way that she was looked after while she was here. I thought you'd like to know. Because often our team members are only here when there's a complaint. Would it be nice if we share when there's something nice happened? Wouldn't that be good for your staff, your team morale? How do you think that's going to feel? Everyone's overworked and underpaid. It's going to lift their spirits, right? So you can see it makes perfect sense together. So now that comes onto the theory. So, and also a bit of a technique, and that is not to make assumptions. How many of you didn't want to pick A because you thought A meant taking the money? Let me know in the chat. How many of you thought, I'm not going to pick A because I don't want to take the money? You see, if you just looked at that on its own, and you could think that, but remember it's and. When you add this to this, it's clear you're not taking the money. Okay? Do you see? But the other thing is that even if you were to pick E, for example, take the money and buy chocolates, there's nothing wrong with that. So some people get in their head that you can never accept gifts from patients or their relatives. And that if you do accept gifts, it can never be gift cards or money. It can only be like flowers or something. That's not true at all. What the GMC says is that you're not allowed to pressure patients to give you gifts. You shouldn't take a gift if it might be seen as inappropriate. Like, for example, if you've got a patient with dementia and they offer you, some money to buy a coffee, it'd be inappropriate to accept it because you don't know that they're giving it freely or that they understand what they're doing. If they've got very advanced dementia, for example, and don't have capacity. Okay. You shouldn't alter the services you provide. So, for example, if a patient was on the ward and you accepted a gift, you might visit that patient more than other patients, and then it might feel like that was a bribe. You see, they've been discharged. You're not going to see them again. There's not any fear of that. If someone voluntarily offers you a gift, you can take it. It's okay. There are other options. Like this is a better option. Okay. What you can't do is you can't pressure them to give you money or pressure them to make a donation. You see, suggest, if you really want to do something, why don't you give the money to the ward? He doesn't have to. You're not pressuring him to donate the money. You're suggesting if he wants to. You're not going to take it, but if he wants to. You see? So do you see how knowing what the guidance actually says can be helpful? But then the other thing is to understand that this is and, that these three together have to tell a story and they need to make sense. Now, how these are marked are 4 marks for each bit. So if you got all 3 of these right, you get 12. You had 2 of the 4 right, you get 8. You had only 1 of the 4 right, you get 4. You didn't have any of these 3, you get no marks whatsoever. Okay. So 12 marks for each bit in the selection, 4 marks for each bit right. There's no negative marking. If though, in the old days when it was pencil and paper, someone that colored in 4 boxes, they'd get no marks. That can't happen now. But let's say you tick this, you tick this, you tick this, then you tick H. You think that sounds okay as well. It would automatically delete the first one you ticked. So be careful about that. Okay. Right. So part 2, just to recap, 19 scenarios, 12 marks each, so 228 marks. You choose, there's 3 subtypes. Choose the 3 most appropriate actions is the most common, like we saw there. But there could be choose the 3 most important considerations. And there could be choose the 3 most appropriate responses to say together. Okay. Last section. So now remember, when you get to the end of this section, You've got 70 minutes. Let's say you couldn't finish this. It would just stop. Then you've got the choice of a 10-minute break or not. Then the second half of the exam starts, which is part 3, which are all ranking questions. You can't now go back to that section. Okay. For these, you get a scenario. There's 5 options. You rank them 1 to 5, where 1 is the best, 5 is the worst. You cannot have tied ranks. It won't allow you to do that. You can't have, or you mustn't leave any blank ranks. You could leave a blank rank, but you're going to lose marks. Okay. And you rank what a good doctor should do, not necessarily what you would do. Okay. Okay. Have a look. So what I'd like you to do is 2 things. Number 1, I'll launch a poll. Just select in the poll, which option did you rank number 1? But then in the chat, type your full order. I can't make the poll do it, so you can actually rank how you do it in the exam. I'll show you what that looks like in a minute. So very interesting. A split in terms of what people put as their first option is nearly even, but half put B, but half put E, okay, as their first option. And if I look in the chat, we've got EBCDA, ECBDA, EBCAD, EBDAC for those that put E first, and then those that put B first, BEADC, BEDAC, BEDAC again, BECDA. So again, big range of answers. So again, let's read through, picture the scene. So you're in obstetrics and gynecology now, and this lady's given birth, having a massive bleed, postpartum hemorrhage, okay, massive. Just before she lost consciousness, okay, so in the last few minutes, she's just become unresponsive. So she's lost consciousness. She's still got a pulse and she's breathing out. She's not in arrest, but she's unconscious. And you know that she's a Jehovah's Witness and has signed a form saying she doesn't want blood products, even if her life is threatened. That's exactly what's happened, right? And the midwife has confirmed that that was still a wish before she became unresponsive. Okay. Now, you can imagine her husband, wife's just given birth and now is bleeding out, really upset and wants you to give her blood. So that's the scenario. So the preferred response is EBDAC. Okay, there's only ever one order in these that will give you full marks. That's worth 20 marks. Okay, so let's look at why this is the order, and then I'll explain how it's marked and why some of you, the key technique that might have led some of you to have got this wrong. So first of all, those of you that put BEDAC, if you had BEDAC, you'd get 90% of the marks. You'd get 18 out of 20 for this question, because this type of question is marked using a really complex marking scheme. It's called keyed response marking. Every possible order has a number of marks keyed to it. So the closer your answer is to the best response, the more marks you're going to get out of 20. Okay. Even the worst order, as long as you rank everything, even the worst order, you'll get 8 marks out of 20. Okay. The only way you're going to get 0 marks is if you didn't rank that question. You didn't drag things across at all. Okay, so those of you that put B number 1 and E number 2, just share in the chat. Why did you put B first and E second? I just want to look at people's thinking. Just share that with me. While I give you a second to do that, let me just show you how it's marked, and then we'll go through it. So as I mentioned, it's keyed response, 20 marks if you get it exactly right. The worst possible order, you'd still get 8 marks as long as you ranked everything. Okay, there is only ever one answer that gets to 20. Now that can be controversial. Remember, it's situational judgment. It's not like maths where there's a definite answer. There's often difference of opinions, and that's why they give partial marks for answers that are close. So the only way it is possible to score less than 8 is if you left some items unranked. So this is how it works. Okay, let's say you had your scenario here. You'll have your 5 options here. You drag them, whatever you think first, you drag it to first. Whatever you think second, you drag it to second. Let's say someone just left 2 on this side. They can get less than 8 now. Let's say someone didn't get to a question, so all 5 of these are here, they'll get 0 marks. But as long as you drag each one of these 5 somewhere, you'll get at least 8 marks for the worst possible order. You have to try to get 8, to be honest, okay? If you give it a sensible go, in most questions, if you don't get it perfect, you still get 18, 16, 14, okay? You'll get a lot of marks, okay? So let's go back to the order so that I can move on to the next section. So, all right, so a couple of people that have given different things as to why they've put B first. Someone said, one of them was that they thought that it would take too long, and someone else said that it prolongs. So that's perfect, because that's the most common reason for people to lose marks in the ranking questions, is that they're thinking about the questions in totally the wrong way. What they're thinking is, this is going to take a long time, contacting a consultant. You've got to page them, they've got to bring you back, then you've got to explain it. That's going to take a long time. And so they're thinking about it as a sequence of time. They think, he's asked me a question, I'll just explain that quickly, and then I'll do this, and then I'll do this. And then if you think about it like that, you are regularly going to lose marks in the ranking. The key word for ranking questions is or. You have to imagine you're only going to do one of them, which is the best one if you could only do one, and that in its entirety is all you're going to do. Would you do this one? Is that better? Or this one? Or this one? Or this one? Or this one? If you could only do one, i.e. each of these is separate, it's discrete, and imagine it's the only one you're going to do, which is the one that shows most positives or negatives for those 5 domains. Everything maps back to those domains, okay? And you'll see why E is the best option. If you could only do one, you should do E. Why? Because E shows that you recognize your limits, which is one of the key domains, okay? That you recognize that as an F1, this is way above your pay grade. This is not just a really seriously unwell patient, but now it's medico-legally complex, ethically complex, because she's got a valid advance refusal, but the husband wants you to override that. But right now, she's also bleeding, but it's confirmed by the nurse that this was still her wish. And so you see, this is really, really complex. So you see, E recognizes that this is way beyond your limits, but also one of them is about team working. You don't need to tell your consultant about everything. But would you all agree that when it's life or death, and ultimately the consultant is responsible for the patient, not you, that this is something they need to know about? Absolutely. It also highlights that you need urgent assistance. So you're recognizing your limits, you're contacting your senior and communicating something important, you're recognizing the urgency, so you're thinking about the patient's needs, but also someone who's unconscious but has still got a pulse and is breathing, i.e. not in arrest, they could later become someone that goes into arrest. You're continuing to monitor the patient, because while you can't give blood, you could still do CPR. You could still do other things, you see. So if you could only do one, E is the best answer. It's the most complete. It shows positives for multiple domains. You see, if that wasn't an option, it's not I'd then do this. You're only doing one. If that wasn't there, the next best option, if you could only do one, is this one. Because he's asked you a question and you're explaining, look, I have to respect your wife's decision, because what she's given is what we call an advance refusal. Those are binding in law now. We always had a professional duty to respect patients' wishes, but they're now binding in law, okay? And so, you see, you explain it, but you see, this one, doesn't recognize, remember, this is your whole answer. You're not going to then do something else. It's not this, then this, then this. It's, if I could only do one, I'd do this, or this, or this, which is better, or which is worse. This is the best option. Okay, this is the second best option, because the difference between explain and tell, you see, in both of these, in all of the rest of them, you're not recognizing your limit and getting senior help. That's what makes E the best option. Okay, but between B and D, you see, B is better than D in that you're explaining. And that's better than just telling them I can't do anything. Explaining the reason is better. It shows better communication, so it's more professional. Think about empathy and sensitivity and communication, one of the domains. And you see, this shows more positives than this. You see, option A is worse than D. If you ignore them, they just asked you a question. You know, I want you to give my wife blood. Just ignoring them and doing nothing is worse than at least giving a response, saying I can't do anything. That's better than just ignoring them. That's really rude. See, this is likely to lead, think about the outcome. This is likely to lead to them complaining that you were unprofessional at a time that they were distressed. And that's a valid complaint. However, C is the worst option, and this is where knowledge will help you. So because a valid advance refusal is binding in law, to arrange an urgent blood transfusion in this situation as an F1 is not recognizing your limits. That's beyond what you should be doing. You should recognize that that decision, you know, if someone's going to override an advance refusal, a consultant might do it, having discussed it with another consultant, but as an F1, woefully not recognizing that this is way above limits of your responsibility. But it actually would be considered an assault in the UK. To give someone blood who has said, I do not want it, even if my life is threatened, it would be considered an assault. This one would get you told off. This one would get you struck off. That's why it's the worst option. Okay, so this is the biggest thing that I want you to take from this. Ranking questions, the keyword is all. You're not doing all of these in a sequence of time. You're only doing one of them, which is the best one. It's comparing to the one above and the one below. Is this better or worse? Does it show more or less positives for those domains? That's why it's E, B, D, A, C. But how they're marked, as I said, if you had B, E, D, A, C, overall, that's still fairly sensible. You'd get 18 marks for that. Whereas you can see, if you had these three right, but you put the bottom one at the top and the top one at the bottom, you get a really low mark. So overall, that suggests that you've got poor judgment. Okay. So part 3, to recap, 38 scenarios, 20 marks each. That's why it's so many marks. More than half the marks in the paper are in part 3, 760 marks. 3 subtypes, where you rank the appropriateness of actions from most to least appropriate. That's the most common type. Where you rank the importance of considerations from most important to least important, and rank the appropriateness of responses to say most appropriate to least appropriate. Okay. So key changes in the new format SJT, and especially for this year. First of all, 3 sections instead of 2. So for example, if you see the old practice papers and almost all of the old books on the SJT, they just talk about 2 sections. That's because the SJT for 8 years only had 2 types. They had the ranking type, which is now the 3rd section, and they had the multiple choice selection type, which is now the 2nd section. Ratings were new 2 years ago. They're now the part 1. The things to say subtype, which is possible in all 3 sections, completely new, only introduced recently, last couple of years. That's why you won't see that type in, again, the older papers. They just weren't there. Evolving scenarios. We haven't seen an example here, but you'll sometimes see some scenarios where they give you a scenario, and they give you some of it, some of the stems, then they add another bit. They say, okay, this now happens. The consultant comes down and he agrees that we have to respect the patient's wishes and not give blood. However, now the patient's husband becomes aggressive. How do you now handle, and then they give you some more options. Okay, so evolving scenarios where they give you additional information. Video scenarios, because the old exam was pen and paper, that wasn't possible. Now it's online. You will have some questions where there'll be a short video clip instead of a written scenario, and then one of these types of questions. And then the biggest change that happened last year that you really need to be aware of is that the exam is now split into 2 separate sections. So 70 minutes for part 1 and part 2 combined. Then the 10-minute break, that's optional. If you choose not to take it, I recommend you take it. If you choose not to take it, you won't get any extra time. You'll still only have 70 minutes for part 3, which is the ranking questions. Okay. So some tips for part 1, rating. Read the scenario carefully, just the first time. After that, just really quick for each of the substantive bits. Think about inappropriate as very inappropriate. Map back to those domains every time, and consider each stem separately. You can use some options once, more than once, not at all. It's not like, I haven't used this one, so I have to use it. Okay. You see, so this is inappropriate. This is also inappropriate. If the next one was also inappropriate, put inappropriate for that too. Okay. Part 2, it's about 3 choices combined. Think keyword and. Okay. Does it make sense together when you add in the word and? And then watch out for pairs and triplets. Sometimes there are things that wouldn't make sense if taken together. Look here. You see that it wouldn't make sense to suggest he buys chocolates and to take the money and buy chocolates. Why don't you buy chocolates? Actually, I'll take the money, I'll buy chocolates. When you think about it like that, it clearly couldn't make sense for D and E both to be in the answer. Equally, C and E. Why don't you donate the money to the ward? Everyone, no, I'll take the money. It just wouldn't make sense. So then they can't both be in the part of the right answer. So, you know, if you picked one from a set, you can eliminate the other set. Okay. Similarly, this. Okay. Part 3, ranking. Read all the options before you rank, because this one is comparative. You're comparing to the one above and the one below. How can you compare unless you know what they all are? And they're not asking in this one if it's right or wrong. Sometimes they're all bad. It's just, is it better or worse compared to the one above and the one below? And consider the potential outcomes and the potential for harm and the potential for benefit, and read the stem carefully to watch out for those new subtypes. Okay. And then things to think about for all of the paper, for all of the scenarios. Think about both how you manage your time. That's really important, because a lot of doctors struggle with time and lose marks. If you don't see the last 2 or 3 questions, 3 questions is 60 marks at the end of the paper. 60 marks might be several hundred places in the national ranking. But also think about the impact of time. There might be some things that delaying might lead to escalation. Therefore, that might be more important to do more quickly than something that doesn't. You know, you've got to think about the impact on the outcomes. Think about who to involve. So we saw an example where life and death are very serious. You clearly need to recognize this is not something for a junior doctor to do on their own. And recognizing your limits and getting someone senior urgently is going to give you, it's going to show that you're going to be a sensible junior. Think about when to have a formal versus an informal approach, depending on the situation. And because one of the things about empathy and sensitivity, don't just think about the options for yourself. You need to consider how it might impact you, but also think how might different options impact patients from their perspective, other members of the team, maybe a specific colleague that's mentioned in the scenario. Okay. Think about lines of authority. So, you know, if you've got an issue with someone, generally it's sensible to try to resolve it directly with them. If that's not possible, think who supervises them, and that would be probably the next best option. And then you need to have a really good handle on ethics and a good working knowledge of good medical practice, which brings me on to that core knowledge that for some questions, for a lot of questions, just looking at the scenario, mapping to the domains and remembering the difference between the different types is all you need, and managing your time. But for some, knowing, because they ask you to rank what a good doctor should do, not necessarily what you would do. To know what a good doctor should do, you look at what does the GMC say a good doctor should do in some of their guidance. So knowing the biomedical ethical principles and how to apply them, autonomy, beneficence, non-maleficence, justice, confidentiality, knowing when you can and can't breach, when you have a duty to share with others, capacity, including, you know, Gillick competence and the Fraser guidelines and when and how to apply them, consent and how Montgomery, Bolam, Bolitho, and the new GMC guidance applies. The good working knowledge of duties of a doctor and the key ethical guidance on things like child protection, safeguarding, end-of-life care, the Tracy case, personal beliefs in medical practice, raising concerns, prescribing, maintaining boundaries, social media increasingly, financial issues and gifts. We just touched on that lightly. Okay. So, you know, because they ask what a good doctor should do rather than necessarily what you would do, some questions do test that knowledge of key guidance, or at least having that good working knowledge will really help you. So you want to make sure you've got a good handle on that. Okay, so that brings me on to questions and answers. So what I'm going to do, I'm going to ask you to type any questions in the Q&A, not the chat. I'm going to do the summary first, so that then we'll come back and do the questions. That way, anyone that hasn't got questions, we can finish. So I want to talk about useful resources and final tips. So first of all, in terms of how to prepare, you really need to understand those domains, and each of those domains is broken down into subdomains. So there are about 100 subdomains. You need to have a good working knowledge of the updated good medical practice and the key GMC ethical guidance. You need to have a good understanding and practice to time the different question types and response types. Okay. So useful resources. There is only one online new format official FP practice paper. However, it's not been updated for the 2023 formats. When I say it's new format, it has got ratings questions, it has got ranking questions, it has got selection questions, but the timing is incorrect in that it is not, you can go back from section 3 to section 2, which you can't do in the real exam. It also has not the correct number of questions in each section to reflect the real exam. Okay, I actually contacted the Foundation Program Office and mentioned this last year that they should update it, and they just haven't done it. Okay, so but at least it's got the 3 types. That's the only one that's official. The other online sample papers, they only have the selection, multiple choice, and ranking. They don't have any ratings questions. Okay, the SJT monograph lists what those core domains and subdomains are. The Good Medical Practice in Action on the GMC website has animated scenarios that can help you think about things, and then getting a good working knowledge on GMC ethical guidance will help you. Now, if you want to cover everything efficiently and quickly, then what you'll find really helpful is our Foundation SJT course. It's been running for 10 years now. We've been running courses to help people pass the SJT for the MSRA for specialty training for more than 15 years. Okay, so we will cover all of that key GMC theory. We'll cover all of that in one session so that you know how to apply, and you can revise it in one part of one day rather than spending weeks doing it yourself. But also we'll look at how to then apply it in the context of the SJT. We'll cover specific techniques for all 3 sections, and we'll go through all 9 subtypes. We'll do, like we've done 3 questions just now, like we've done, one for ratings, one for selection, one for ranking. We'll do a 24 like that, where we go through in depth and analyze them in detail, teaching mock with discussion, alongside additional ones when we look at each section at the beginning. And then after the course, you get free access to our online SJT questions in the new format with ratings, ranking, selection. There's over 218 SJTs, including a timed mini mock. Okay, so details of the course are here. And as I said, we've been running for 10 years. We've had excellent feedback and results every year. I think one of the biggest things is that outcomes. So like, for example, last year, about 94% got one of their top 3 choices. And the top scorers last year from our course were actually 2 of the top scorers in the country. So the highest scorer was there. They scored 50. Interestingly, the 2 top scorers were both from Bahat, and they both went to North London. And then this now doctor, but then a student, Katrin Sahrabi, has actually written an article, which is on our blog, the Emedica blog, about her experience on she's got some really good tips on there. She's got 49.985. You see the difference between these scores? That's like one part of one question. Okay, and then we've had a really high proportion, as I mentioned, historically less than 10% score more than 44%. Last year, based on those that responded to our survey, we sent that after people have been on the course, more than a third scored 44 or more SJT points last year. And that's probably why so many ended up getting one of their top choices, right? So, and then if you're not going to come to the course, the practice questions online, which are different to the questions that we go through in depth at the course, they are available separately. It's £35 for 3 months. They're available here, okay? So really, the course, we've got 2 dates, 15th October, limited spaces left for that one, and then 12th November. It's a really long course. It's intense. So 9:30 a.m. to 6 p.m., over 6 hours of CPD. We will have a lunch break and a break in the morning and the afternoon. It's £99 if you book on your own. If you get together with 5 friends in total and book as a group of 5, it's only £84 each. So you say £15 each if you book as a group of 5. Okay. So just to summarize, really, look, the SJT is a really important factor in your ranking. It's actually more important than the EPM in most cases. For some questions, having core knowledge about GMC and ethical guidance will really help you. What's essential for every question is to understand those FY1 attributes. And one of the things we cover in the first session of the course, we look at the breakdown of each of those 5 core domains into some of the key subdomains. What are they actually testing and how to spot them? And we'll go into depth the approach to the 3 sections, because the mindset's very different. They're marked in different ways. And we'll also look at very precise timing for each section. That's going to help you to make sure that you finish in time and get a high score. And then the key techniques and how to apply them. And by practicing under sort of exam conditions and then going through the questions afterwards, what we've seen over the years is that having a good handle on these things and understanding can definitely optimize your performance. But on the day, there's no surprise. Imagine on the day you turned up and you planned your timing such that you're going to spend a certain amount of time on section 3, and then suddenly you're like, oh, I've run out of time. I'd planned 85 minutes for the first 2 sections, or if you thought, I'm going to split it into 3, a third, and then, you know, like, you'd really be thrown. And then that might affect your mindset to even look at the last section, which is where most of the marks are. If you didn't know that the selection are and, you might approach it in the wrong way. If you didn't realize you could use the same ratings multiple times, you might completely mess up, not because you haven't got good judgment, just because you didn't understand what the examiners are testing or how the exam works. You see, so once you understand all of that and you're confident that there's no surprises, then practice and preparation can optimize your performance, so that on the day you're calm, you're confident, you can really give it your best shot. And then ultimately what we want is for you to get your first choice, and for me to get an email just to let you know I've smashed the SJT, and you know, I've got my first choice foundation rotation for the next 2 years. Okay, so I'll leave you with this, adapted from something attributed to Abraham Lincoln, that if you have 6 hours to chop down a tree, you do well to spend 4 hours sharpening your axe. And if you spend a good amount of time in preparation, on the day your task will be easy. You'll slice through the questions with ease. Okay, so last thing to say is, first of all, huge thank you to the Emedica team for all of your hard work and answering questions. Huge thank you to all of you for giving up. I know how precious your evenings are. You're all busy, you're studying. You know, thank you for joining, and I really hope that you found it helpful. And whether you come to the course or not, I hope at least you go away and let me know in the chat. You know, do you feel that now you've got a clearer idea of the exam? Have you picked up some tips that maybe you didn't know about? Do you have a clearer idea about what to expect on the day? Are there some things that maybe weren't common knowledge, or you didn't know how it all worked, or how the scoring is, or about some of these different new types of questions? Because a lot of the resources, even on the official site, they're not updated. Okay, so, you know, I hope you found it helpful. For those that haven't got questions, thank you so much. Prepare and you will succeed. You know, our whole team at Emedica wish you every success with your SJT and in getting your first choice job. Okay, so keep pushing, keep going, prepare, and you will succeed.